Hi, I'm Kat. I'm the CEO and co-founder of SimplyVital Health, and we are merging blockchain and healthcare. But usually when people hear blockchain, I think in this crowd, we've gotten a little bit past the hype. We understand the real utility of it and why it's so wonderful. And healthcare, it's still a little bit hyped. Still a little bit of excitement around it. People are still thinking that they're going to store an entire electronic medical record on the blockchain, and there are usually rainbows and unicorns that arrive in the room when we talk about blockchain and healthcare. But how are we actually going to bring blockchain into healthcare? And that's not necessarily the way that you should look at it. And I'm actually grateful that Uma spoke first, because our perspective is that it doesn't actually matter what the technology is that you're using. You need to make sure that there is an application that makes sense, and there's a reason that healthcare should adopt that application. Specifically, what is often talked about is the movement or the access of healthcare data and the leverage of blockchain technology. But I'm here to tell you that sharing healthcare data is actually a business issue, not a technology issue. But security is still really, really important with sharing that data. And so I know that healthcare data movement and access is a business issue, not a tech issue, because I used to work in healthcare. I'm a former administrator at Yale New Haven Hospital, and my job was to move through millions of rows of healthcare data to grow our market share for the hospital. But in order to share that data, there needs to be an extra layer of security. And that extra layer of security is actually what blockchain can help us do. So Yale New Haven Health, where I moved through a ton of data. I also worked at Community Health Center, Inc., where I took data and put it onto a dashboard that the providers at that community health center use every single day. And I'm a former Teach for America Corps member. And in each of those roles, my focus was using data. Most of that data came internally from the organization I was working with at the hospital and for Teach for America. But at Yale New Haven, I was exposed to this entire new world where we would spend millions of dollars purchasing healthcare data. And none of that came down to the patient, none of it came down to the hospital, and none of it came down to the physicians that were creating this data. It sits at the health insurance level, and at the top level, there are 3 companies in the United States that benefit from this. And that's why we're creating Health Nexus. And Health Nexus is specifically tailored for healthcare. It gets back to that security piece. It's a blockchain that's HIPAA compatible. And what I mean by that is it is a true protocol. It's not an app that we're calling a protocol. It is a fork of Ethereum with its own governance and consortium methods. It has its own consensus mechanism. It's a combination of proof of stake and proof of authority. And then the most specific piece about it is that we create, in order to run the system, you have to have a HIPAA-compliant server or HIPAA-compliant computer. We actually hooked one of our investors, equity investors, this way. When I first met him, he has a server room that sits behind bulletproof glass. He loves his server room. And I said, you have extra space on your servers. Would you like to make money on that? And he said, absolutely. And I said, that's what we're doing. We're helping to create a blockchain technology that's safe. It's open source. Anyone can use it. One of the specific ways that we're using it is to focus on care coordination. In order to make care coordination work, you have to have access to data. There are providers from different clinical affiliations that need to see that data. A really good example is ETHRX. This is a company that built on our protocol at a hackathon. They reached out to us, they found us online, and what they do specifically is they connect patients to pharmacies and these patients have had a transplant. One of the biggest issues in transplant is your body tries to reject the organ. The only way you can maintain that organ is if you have the right prescription. This connects them in near real time. The other one we're working on with 2 Harvard physicians is focusing specifically on behavioral health and addiction. This is a very, very important area of healthcare where privacy is key, but also the ability to share data is really, really important. With this application, it's a focus around telemedicine and data sharing. So those are specific examples that we are working on right now in healthcare. Notice in none of those descriptions did I mention the word blockchain. When we approach healthcare, we don't talk about blockchain technology. That would be like starting our pitch saying that we are using the cloud or AWS. They don't really care. But it's really, really important that you start with that in mind. The last thing that I leave you with is trust the process. There's a lot of work that we need to do in healthcare to bring applications that are backed by blockchain technology into the healthcare space. We're working on it. We're already in motion. We'll get there eventually, and we'll eventually get to the point where you actually are able to maintain and control where your data goes and benefit from that. Thank you.